what is destroying the system is corporate medicine. It used to be you had individual practitioners, or maybe 2 or 3. I remember when my kids were born, there was a group where there were 3 obstetricians that covered all the pregnant ladies around. And now it seems the medical groups, almost everybody is owned by some big corporate entity, hedge funds or private equity. They're owned by non-medical people, and their only concern is the bottom line. Doctors are required, okay, you've got to see 8 patients an hour, whatever though. And they crank people through, and what is lost is the personal aspect. I mean, I had an experience not too long ago, I won't mention any names, and I felt I was a metric. I was test results. I was numbers. If the numbers were good, everyone's happy. Nobody really seemed to care who I was.
It's not even solely about the, I came here and X and Y was done for me and that fixed me. It's also about the just kind of feeling of, I feel like I am comfortable with these people and I trust them and they respect me too. Would you say that's an important part of care as well, and becoming, getting healthier?
Yeah, give a damn.
Give a damn. I like that.
Or at least show. Make the patient think you give a damn.
Right.
And I know the physicians complain about that as well. They don't like the situation. They don't like being forced to kick people out after 15 minutes or whatever their allotted time is. My wife fell, and she fractured, it turned out, her leg. Said, you need to see an orthopedist within 72 hours, because these things often require surgery. And here's the name and all the contact information for, let's call him Dr. Smith. So I came home, called Dr. Smith's office, went to voicemail, of course. However, a little while later, we got a call back from a woman. Now she's calling for the doctor. Oh, great. What she wanted was the insurance information. First things first, got to get all the insurance information. Oh, but I can't make an appointment for you. Why not? Well, though the doctor has to do that himself. You'll get a call from someone from the doctor's office. We're still waiting for that call.
Really?
It never came.
And it's...
The next day we get a call from a nurse from the emergency room, because I said, when we left, said, would you like follow-up? I said, yeah. She said, I told her, she said, oh, let me do it, I can get through. She called back an hour or 2 later, she said, I could not get through to the doctor's office. When we finally got it, was 10 days after the fall, not 72 hours.
Really?
AARP magazine had an article on saying why you can't get doctor's appointments. There's a lot of doctors are leaving the profession earlier than they might have. One of the reasons being they're caught in this corporate mess. And they're not allowed to practice medicine the way they were trained and the way they used to. What became a primary care doctor, he retired on me without asking my permission. And we had like a 30-year relationship. We supposedly have this really great medical system here, but we don't. We have really good doctors, we have really good technology, but trying to get access to it on a timely basis is getting more and more difficult. Get all the non-medical people out of the medical profession. I don't think that's possible anymore, because they've all got lobbyists and patients don't.